I was not sure if I understood right. You showed the three articles in de WGG, no, WW enzovoort, de Wet op Goede Zorg. And I wasn't sure if you said that the first article was not applying to alternative medicine, but I'm not sure if the second article was also not implied, because if that was the case, it's implied, and there's a lot of reasons to say that a lot of alternative medicine doesn't follow that second article. Do you understand what I?
Yeah, I think I understand what you're. I understand what you're asking. It's a weird way that the lawmaker defines the article, because they say that everybody has to provide good care, and the third article said something like, I don't know the translation of onverminderd, but it's like, it looks like it's not applicable to the non-regular healthcare provider, but it's not. Of course it is. It's 1A plus B. They have to adjust good care as well. But the added demand is that they are not supposed to harm patients. We would all love to think that in regular health care that's the same, but it's not legally.
And the issue of autonomy, which is stressed so much by Kevin, how do you deal with that in... I'm asking the lawyer. You're puzzling me. That's right. I mean, how... What you said? Well, you started tongue-in-cheek. I'll explain that for the guests from abroad. Tongue-in-cheek, you said, well, they were talking on a much bigger level than you were doing, and that's true. You're a real practice guy, real from the mud, I would say,
the clay,
farmer in the mud. Well, more in general, how do those theories? Because particularly what Dr. Smith just said, the autonomy, how should it be protected?
I'm very glad that I'm able
may you lie
to answer that. No, of course you may not lie. You may not lie, and because lying to a patient is taking away its autonomy, and that cannot be done. And that is why our civil code says to the doctor, you have to inform your patient adequately. That's what we call informed consent. You cannot respect a decision to be treated by the patient if there's not adequate information provided before. It's a very, very basic thing. My frustration in the law is that in Holland, if a doctor fails to provide adequate information to a patient, it said, the courts say there's a lack of informed consent. And then the patient says, well, I agree, but I like to get my damages as a result of that surgery that completely went wrong. And then the courts say, you can only get your damages compensated if you, as a patient, prove that you wouldn't have agreed to the surgery if you informed completely. Yeah. So, and I think that important rights in life only matter if a patient can go along with those rights and get them respected. If they're not factually respected, they don't mean nothing. So I would love to change the law and the courts system and get that more seriously done.
Okay, thank you.
Did I make myself a little
bit
clear?
You make it clear. Ja, er was niet iemand eerder dan die dame. Jij komt aan de beurt, ik heb je gezien. Nee, deze dame, die staande dame eerst.
Ik zeg het toch even in het Nederlands.
Ja, ik kan het vertalen als je wilt.
Ja, wat u zegt, hè, van die patiënt die moet alle informatie krijgen. Nou, ten eerste heb je soms enorme haast om iets te doen. Ten tweede is, hoe maak je de afweging, bijvoorbeeld in mijn vak, oogheelkunde, een kans van 1% of minder op een endoftalmitis na een stare-operatie. En in hoeverre heeft die patiënt het allemaal besproken? Dus ik ben natuurlijk voor informed consent, maar ik ben ook wel een beetje bang om af te stappen van de inspanningsverplichting vergeleken met de resultaatsverplichting. En daar zit gewoon ook een groot risico aan en dat mensen met meer kans op complicaties niet meer die zorg krijgen.
Checking if I understand you well, I will translate it in English because it also reflects to both your talks. Her question is, well, we have, both of you are stressing, or all of you are stressing the need for autonomy, for good information, but then there's the difficult thing of real life medical practice where you have shortage of times and where there are different risks. I mean, there are indeed, particularly for my own profession in cancer care, there are real big risks, or taking your example, the hernia operation of a patient which has the risk of paresis, and there are really rare risks. Who can I give first? Theory and practice, that's actually her question. How do we deal with real life? Dan.
I think Kevin presented this dilemma very well. It's a risk-benefit analysis. So with evidence or science-based medicine, there is a good chance of benefit, whereas for placebo treatments, that's negligible in many cases. And I'm sure, Kevin, you can expand on that.
Yeah. If this is working, is that working? Yes, thanks. Yeah, absolutely. The risk-benefit calculus is central. I think I do also recognise the time limitation and also the comprehension limitation when trying to obtain consent based on truly informing a patient, and of course that's an issue, but I think that, if I may say, should be part of the art of the physician, whereby they are able to summarise matters to the patient sufficiently for that particular patient's level of comprehension, and of course within the practicalities of time frames available. But a crucial underpinning must be that they are actually their own understanding, which they will use to base the informed part of the consent upon, must itself be based on some kind of scientific, bona fide and valid mechanistic understanding of what is behind the modality that they wish to treat the patient with. They've got to simplify it, there's no doubt about that, but the mechanistic understanding has got to be there.
John, do you want to comment on that?
Yeah, I don't think there's anybody in the room who thinks that you can put a knife in a patient without consent. I mean, that's just basic human rights. So the risk-benefit thing is, which treatment do you recommend to your patient, if any? That's it's in the atmosphere of the doctor, but you have to explain that to the patient and try to get the consent. It cannot be done without it. And if you have not enough time, I do understand that. You have a terrible profession.
Yeah.
You have a lot of obligations, a lot of things to do, many patients. But that's really not relevant, I'm sorry to say.
Dan, you wanted to comment on that?
Yeah, there's another aspect also, and that is in emergency medicine, when the patient perhaps is unconscious, there is no consent to be asked for, and there one has to rely entirely on science and evidence-based medicine. But there's actually another thing I wanted to add also, and that is the time that the healthcare provider can spend with the patient. Because in regular evidence-based medicine, there's a time limit of perhaps 10-15 minutes for the patient to see the doctor, whereas in alternative medicine, the homeopath can spend a whole hour with the patient in the first meeting, where the patient essentially tells his or her own story. And there's more time for an alternative practitioner to mislead the patient due to this time difference. So we are not playing the game with under equal conditions. There is much more pressure on a licensed health practitioner, time limits, and also to keep records. Alternative medicine doesn't have those requirements.
Talking about time limits, I regret to have to cut off a lively discussion. For one question there, yeah?
Ik doe het ook even in het Nederlands.
Ik vertaal wel weer, probeer het in houtjes, stoutjes Engels.
Nee, ik was getriggerd door de enorme hoeveelheid zaken die in de reguliere zorg plaatsvinden. En ik vroeg me eigenlijk af, is de reden daarvan omdat er gewoon veel meer financieel te halen valt? Als je een zaak aanspant tegen een ziekenhuis of een artsenpraktijk, daar valt meer te halen, neem ik aan, daarbij iemand die thuis reiki uitoefent of wat spelden bij iemand in zijn nek steekt. En daarnaast bij de alternatieve genezers heb je vaak ook dat ze de schuld bij de patiënt zelf leggen, dat ze niet hun best doen en dat ze daar ook niet zo snel een zaak van gaan maken. Nou ja, dat was het eigenlijk.
Well, translate it short. John Beer explained that he sees many more medical cases in regular medicine and fewer alternative cases. Is it because you get more money from doctors' cases than from those poor alternative medicines?
No, it's not. No, it's not. First, it's the numbers. Really, I mean, we do not get many cases from the alternative. And second, if you're not allowed to touch the voorbehouden gebieden, the very specific terrains which are only accessible for regular medicine, then you can do no surgery, for example. Then you cannot do deliveries, for example. And now I'm giving you the cases where most of damages occur.
With ayahuasca rituals and LSD, like drugs, it's now a lot of going on.
Yeah, we don't see them, and I can really not see, perhaps only in extreme cases, that there's a lot of damages, really, physical damages.
Martin, I wanted to discuss another thing with you. You convinced me actually that we should very reluctant to oppose as doctors on X or all those social media. Be very careful if you're a doctor to do that. And then the second thing, I disagreed with you, and that is where you said, keep to the rules of your profession. Those guys, those professors know better than you do. How should I express my discontent with some of the things my dear fellow colleagues put in their protocols and their guidelines?
Well, I assume that within the medical professions, the scientific organizations are adhere to democratic rules. That is, that they look at the evidence, they study the literature, they discuss among themselves which way to treat a certain condition is best, is most effective. And I assume that those discussions are inclusive, participatory, transparent, and that the decision-making processes are reasonable. So if an individual professional ventilates another opinion through the social media once the profession has agreed upon something else, then the profession itself should, hold that individual accountable. There's nothing obscure about that. Your discomfort seems to be with the way your own group of peers discusses things among themselves. I'm just a lawyer, a bystander. I simply say to you that, you need to organize those things properly amongst yourselves.
I
And
think I can agree
if you
with
don't,
that. I can agree.
you
But
know,
the way how to maybe is how to agree.
yeah. But if an individual physician makes propaganda for an alternative treatment when his profession has decided upon something else, then it is the profession who should hold him or her accountable. But I would go even further. Such a doctor shouldn't be allowed on social media, and if he does, the group should take care of him. But even if the a doctor is in agreement with the group's points of view and ventilates those opinions through the social media, he should be well aware that he is in fact devaluating the truth claims of the profession.
Finally,
That's
we come to
really
an agreement, and that's maybe a good point. Unfortunately, time is our biggest enemy now. I have to conclude. I would lovely and gratefully for such a wonderful faculty here. Thank you for your presentations. I thank you for coming here, and hope to see you next year. But first, de borrel. Drink.